Good morning. I'm Dr. Pendleton. I'm going to give you a quick little video. We're going to give you some facts or common questions that are going to answer before we start our week intensive with you. So the most common question is, why are we doing so many treatments in a week or 2 weeks? Simple answer, we're trying to promote neuroplasticity. Neuroplasticity is we're trying to make your brain that's been injured, and the areas of your brain injured, kind of talk to each other again or learn. So when we learn how to ride a bike, we learn how to swim, we do enough repetition, enough times with enough repetition, the brain starts to learn it. So I'm just going to try to make your brain relearn and then grow and become neuroplastic. Second most common question is, what kind of exercises or therapies will you be doing this week? It really depends. Each person's different, but it'll be a combination of what we call head-eye vestibular motion therapy, which is we're going to be moving your head as your eyes look at certain things on an iPad. The next question is, how will you feel during these sessions? Everybody's different. You may feel really good doing these things. You may feel a little dizzy. You may feel a little anxious just because you don't know what's going on. But the most important thing is that you communicate with me, because I think I know what you need, but I'm not always right. And you may not tolerate what I'm doing. And that's the thing we don't want to do. I don't want to push you doing these exercises too hard, because you could get a headache or you could just kind of feel worse. And we don't want that to happen, but it can happen as part of your healing process. So it's a very open communication. I'm going to be as honest as I can with you. Please be as honest and open with me. There's no wrong questions during this week or 2 week intensive. What do you do after the day or each day? Rest. Take it easy. Ideally, I don't want you to be stressed out, because you will go home, you will be a little tired or really tired. Some people go home and they nap. They'll sleep really good that night, or sometimes we stir things up and they go like, well, I didn't sleep at all. All that happens, but I just want you to be not stressed and just take it easy. So ideally, don't go back to work, don't go back to school after you're here. Next question. Will we retest you at the end of the week to 2 weeks? Yes, we always do some re-updated neurodiagnostic tests, the ones you did the first time you came in. If needed, we'll do those again, and we can compare pre and post treatment. Next question. What happens when you're done with the treatment with me for the week or the 2 weeks? You go home with exercises. We'll give you a Word document with each exercise explained and how to do it. We'll also videotape on your phone all the exercises we did in the office. Next question. Will you be doing home exercises? Yes, you will. Those are the exercises we discussed. I also like people to do some type of cardiovascular exercise, aerobic exercises. Nothing crazy. Walking, moving up to like exercise bikes. I don't really want people starting to run, because you bounce, and there's a lot of times when you bounce, your head shakes, and we're working on your ability to keep your eyes focused and still. Lastly, will you come back to see me? It all depends on how you respond. My goal is to spend a week to 2 weeks with you, fix you, and I never see you again. That would be the best thing. Some people will come back in 2 weeks, some people will come back in a month to retest, and then sometimes give them more challenging exercises. But again, the goal is to fix you as fast as I can. But again, I don't have a crystal ball, and I cannot give you the exacts of what's going to happen. I hope this video helps. Call us or email us if you got any questions. And I look forward to seeing you and making you better. Amen.